Hello everyone, this is Preeti and you're watching my solution. In this video, I'll be teaching cubital fossa, which is an important question for the university exam, 5 mark question, and it is also important for the entrance exams, like PG exam. This cubital fossa is present in front of this elbow joint. This is the elbow joint. Front of the elbow joint, you can see the triangular depression in front of the elbow joint. This is a cubital fossa. Cubital fossa, it forms a triangular depression. So it has as it is a triangular depression, it has a three sides. So this is a triangle. Like it has three sides. This is a base and this is apex. Our base is formed by the imaginary line joining between the medial epicondyle and lateral epicondyle. Imaginary line joining between medial epicondyle and lateral epicondyle. This forms the base of the cubital fossa. Medial epicondyle, where all the flexors muscles takes origin. This is a common flexor origin, this point. And lateral epicondyle, where all the extensor muscles takes origin. This is a lateral epicondyle. Imaginary line joining these two epicondyles forms the base of the cubital fossa. And medially, it is by the pronator teres muscle. This is a pronator teres muscle. It has two heads, two heads, which is ulnar head and then the common flexor head. Ulnar head will take origin from the ulnar bone, and the other head will be taking origin from the common flexor origin, and other boundary will be laterally. It is formed by the brachioradialis muscle. It takes origin from the lower part of the humerus, that is on the lateral aspect. It takes origin and then forms the lateral boundary of the cubital fossa. This is the medial border and lateral border, and the contents will be two nerves, either side two nerves. This is a medial side, median nerve, and the lateral side towards the radius, the radial nerve. Radial nerve superficial branch will be the content of this cubital fossa, and one tendon, and this tendon is tendon of biceps brachii. This tendon, biceps brachii muscle, will be in the brachial region, that is arm region. Tendon will be extending till here, and this is a artery, one artery, that is brachial artery, divides into radial artery and ulnar artery. Radial artery towards the lateral side and ulnar artery towards the median side. And this is a median nerve. Median nerve will be passing in between the two heads of the pronator teres. If any compression of these nerve will cause pronator teres syndrome, that is during pronation, pronator teres helps in the pronation. During pronation, this nerve is compressed, and we call that condition as pronator teres syndrome. This is all. Once again, I'll go through. This is a triangular depression in front of the elbow joint. It will be similar to the popliteal fossa. Popliteal fossa, you'll see the diamond shaped depression. That will be more similar to the lower part of this popliteal fossa, which is in triangular shape. And then the boundaries is formed by the imaginary line joining between the medial epicondyle and lateral epicondyle. Laterally, it is formed by the medial border. See, this is a medial side, medial border of brachioradialis, and medial boundary is formed by the lateral border of pronator teres. See, medially lateral border of pronator teres. Apex is formed by the overlapping point between these two muscles, that is brachioradialis and pronator teres. And the roof is formed by the deep fascia of the forearm. This is a forearm. From here it will be forearm. This is formed by the fascia of the forearm. And the medial side we can see that the bicipital aponeurosis is a muscle extending part, that is thick fascia, is known as aponeurosis. It forms the medial side roof. And the contents you can remember with the mnemonic MBBS. M means median nerve, medial side, from medial to lateral. Median nerve will be medial side, median nerve, and then brachial artery. As the name says, it will be present in the brachium region, that is arm region, and then it divides into radial artery and ulnar artery. And tendon of biceps brachii will be present in the arm, and then the tendon extends. This tendon of biceps brachii, and the superficial branch of radial nerve towards the lateral side, that is towards the radius bone side, that is a superficial branch of radial nerve. This will be the contents you can remember through the mnemonic MBBS. And the clinical significance of these cubital fossa is there will be median cubital vein. This will be cephalic vein and basilic vein. In between those two, median cubital vein will be there. That also will be present in the superficial superficial fascia. This medial cubital lane is used for IV injections or to collect blood. We use this median cubital vein, and the brachial artery to record blood pressure. We use brachial artery. And pronator teres syndrome, as I already discussed, that is a compression of median nerve between the two heads of these pronator teres is known as pronator teres syndrome. If you find this videos are helpful, please do like, share and subscribe to my channel, and stay tuned to my videos.